Good morning, Montclair, New Jersey, and thank you for being with us today. Today is our part two of emergency preparedness, and this morning's feature is Stop the Bleed. We hope that you will enjoy today's presentation. We have the Montclair Ambulance Unit with us today. We have Deputy Chief Craig with us, who will be leading today's presentation. This will be an interactive presentation on Stop the Bleed, and we hope that you can join our third part series, which is scheduled for May 3rd, and that will be civilian response tactics. With that, I'll turn it over to Deputy Craig, and we thank you all for being here.
Good morning, everyone. Again, my name is Deputy Chief Craig. I'm from the Montclair Ambulance Unit, and today we're going to be going over Stop the Bleed. The Stop the Bleed program was created from the American College of Surgeons, and depending on how young you are, you may have heard tourniquets bad, tourniquets good throughout your life. This program has really solved the issue of that. We're helping stop the bleeding and saving people's lives. There are pictures of bleeding. They're all kind of graphics. They're not actual pictures of people bleeding. This is just a pre-warning, so even if you get a little queasy for graphic pictures or cartoonish type pictures, just making you aware of that. Bleeding can kill. It can kill very, very quickly, but you can stop the bleed. This program was developed mainly out of the military, finding that a lot of combat casualties were dying in the field because of the loss of blood volume. And they did a lot of research that if the tourniquets were applied quicker and the bleeding was stopped sooner, the patient had a much higher ability to be saved. When the study came out through the U.S. military and the American College of Surgeons, they started applying it to civilian life. And because of that, the amount of people in the civilian world has dramatically increased because of the Stop the Bleed program. Where do you think you can use this training? Anywhere, okay? Some people associate the Stop the Bleed program to active threat or active shooters, and it did from that. But to be honest with you, they found a lot of people were using this for everyday accidents, from construction accidents, car accidents, workplace accidents, places you would never think about it. When the Stop the Bleed program came through, I did a quick study of all the times we use tourniquets. And the majority of times we use tourniquets were for everyday accidents, from people accidentally falling through a plate glass window or didn't realize that their sliding door was completely closed, slipped in the bathroom and broke through the glass shower door, car accidents, industrial accidents we've used it for all the construction that happens in town. We have used it in events for events of violence in town, but it can happen anywhere where you least expect it. How long do you think, if somebody has a bad enough wound or injury and they're bleeding profusely, how long do you think it takes them to bleed out or bleed so much that they go critical? Anybody else? Yeah. Within 3 to 5 minutes. Within 3 to 5 minutes, if somebody's injured bad enough, they can actually bleed out within 3 to 5 minutes. Average adult has 6 to 8. Yes. And everyone's like, if you've ever seen somebody who gets into an accident or who has a bad wound that's bleeding a lot, depending on where they're bleeding from, may look like a lot of blood. When If you've ever donated blood or seen people donate blood, they usually take out a pint. The best way I can explain the visualization of blood loss is picture a 2-liter bottle of soda. You need to lose one of those before you start to become critical. Make sense? So there may be a lot of blood. It may look really, really bad, but you need to stop the bleeding before it becomes critical. Make sense? Okay. Alert emergency medical services. Every class we teach, standard first aid, the emergency medical responder course, CPR, all the classes we teach you great skills. We love the fact that you're learning them. But one and the most important thing is all those skills are useless if you're doing it there and you're like, where's the ambulance? And realize nobody called the ambulance. Make sense? You guys are treating and saving the life, but to finish saving the life, we need to get that person to the hospital alive. So make sure you call 911. If you have a smartphone, I'm not going to say its name to activate it. Let's just call it Sammy. Hey, Sammy, call 911, and it will automatically do that. Or, hey, whatever the Android version is, call 911. Or, hey, Alexander, I'm not going to say his name either for the home computer things, which my daughters are now learning. But make sure you call 911. Scene safety. This is the most important thing beyond anything else you learned. If you see somebody get injured, if you see an accident, or you see somebody bleeding, the first and most important priority is yourself. It's kind of hard sometimes. You're like, oh, that person needs help. If you get hurt in the process of trying to help them, you have made the scene more complicated. We may need an additional ambulance. That may take some more time. Your scene safety is the most important thing. If it's a car accident scene or you see somebody get hit by a car in the middle of Bloomfield Avenue, are you going to run out there, kneel down, and start helping them? Or what should you do first? Call 911, and before you start helping them, make sure traffic is stopped. Because if you're kneeling down next to a patient, do you think the car driving down the street can see you kneeling? Extremely, extremely important to make sure the scene is safe. If the scene is not safe, your responsibility is then to keep people away from it until emergency responders arrive. Silly fact, if I see somebody drowning, I'm going to call 911. I'm going to throw something to them. Unfortunately, I cannot go out to save them because I don't know how to swim. Seems silly, but it's a statement of fact. I'm not going to risk my life and risk other people's lives if it's not safe. Stop the bleed kits. You will start seeing these kits just like you will the AEDs throughout public buildings. You may see them in schools. I know where I live, my daughter's school has this right next to the AED. I've been to Newark Airport and have seen these on the walls. They are kits that are filled with tourniquets and gloves to help people in the event there's a bad injury where somebody needs bleeding control. They're starting to become more publicly accessible. They do come at a little bit of a cost, and that's the QR code. Personal protective equipment. Your scene safety is the most important. You want to make sure that prior to providing care that you're wearing gloves. You want some type of barrier between you and the patient. Make sense? We all make sure that you're not going to catch any infections that they may. Most majority. I haven't seen latex. Um, latex. Bad bleeding wound. Out like a bird out like to protect to try to prevent care. I've in the event that the you see somebody, I've gotten to the point where I've walked up and I'm waiting for to put on my gloves and the person's bleeding, and I've just directed them, take both your hands, put it over the wound, and press really, really hard until I have that protection. Make sense? And the barrier doesn't have to be necessarily medical gloves. It can be, I've seen people use Ziploc bags. I've seen people use saran wrap, just something to put a barrier in between them and the wound. Bleeding anatomy. Really, really, really quick. This is not going to be your AP class in college, I promise you. You have your heart. It pumps out a lot of blood. The blood goes, it gains oxygen in the lungs, goes into the heart, and then out to the body where it's exchanged for carbon dioxide. Once the carbon dioxide is used, it goes back into the heart and then back out. There are main vessels in all your extremities called arteries, and that's what has the oxygenated blood in your body. Uncontrolled bleeding. In the event it's an injury and the artery is ruptured, you're going to see a profuse amount of bleeding. Some people may get confused with that with like head injuries. Head injuries bleed a lot, but it may not necessarily be arterial because the heart pumps up. It's the highest pressure point of the body because there's so much blood. So you're going to put direct pressure on it. But in the event it's on an extremity and it's a deep enough wound and you see something literally squirting out, it's most likely a arterial wound. First thing you want to do is you're going to apply direct pressure. Just say I have gloves because I always keep a pair in my back pocket. And somebody puts their hand through a plate glass window. The first thing I'm going to do is walk over, grab the wound, and just put as much pressure on top of it as possible. Okay? If the person is standing up, making sure I'm safe if it's, again, through a plate glass window, or let's say you have work being done to your house and a contractor cuts his arm with a saw, you're going to run over there, make sure the saw is off and it's safe to. Take gauze, a towel, anything that can be absorbed, and I'm going to put direct pressure on that wound as quickly as possible once I know I'm safe. Make sense?
And if it's like a hand, do you want the person to have it above their heart, or it doesn't matter?
It doesn't. You want them to lay down as quickly as possible. That way, if they lay down because you don't want them to pass out and then hit their head. You want to lay down and then put pressure directly on the arm. When I was first taught bleeding control many years ago, there was 5 different steps before you got to a tourniquet. And they realized that delay allowed a lot more blood to get through. First thing is direct pressure. You're going to sit there, you're going to hold it. You're not going to go up every 30 seconds and like, oh, is it still bleeding? You're just going to sit there and hold it. Make sense? What are we allowing to happen when we put direct pressure on the wound? We're going to slow the flow. What's the body trying to do? The body has platelets that try to clot the wound, kind of like a scab, if you look at it that way. And we're trying to allow that to form. In severe wounds, that's not going to happen as easy because there's too much pressure for that to form. In the event the person is on like a blood thinner, it may not be an arterial wound, but they may be constantly bleeding, and it's just going to take a little bit longer for that bleeding to stop. Okay. Wound packing. In the event it's a big enough wound, like we see here, let's say this was caused by a table saw or somebody running next to an old fence and it just cut them open. Put it and it's still bleeding. You're putting as much pressure as possible, and if the gauze or cloth that you have soaked through, do you take off the gauze? Nope, you're going to put more gauze on top of it. And if that bleeds through, you may want to try to what they call pack the wound or fill the void. What you're going to do is take the gauze and then push it into that wound. And you're going to just keep pushing it until you can't push it anymore. Make sense? Yes. They are going to be, if in the moment, the few times we've had to do it, it may hurt, but it's them screaming, they're awake, they're alive, and I'm going to try to keep it that way. Well, go ahead.
Well, one question, you're using the phrase tourniquet. My husband did almost take his thumb off on a table saw. And rather than just putting we wrapped. So I'm curious what the phrase that you're going to get.
Yes. Okay. I like it. You're getting ahead of the class. We are all going to practice each one of these skills momentarily. Okay. So don't worry. Okay. Again, if you have some type of, as clean as you can make it, the bleeding control kits also have gauze that you can basically go. You're not going to put your fingers in the void. Does that make sense? What you're going to do is put it over it and push it into it and just go back and forth. Make sense? Why don't you want to put your fingers in the void? Not contamination. In the event we don't want, if there's something still sharp inside that wound, we don't want you to cut yourself. Make sense? So you're going to sit there and you're going to go back and forth, making sure it is fully filled. And once you can't fit any more of the gauze into the wound, you're going to take what's left over and again apply pressure. Make sense? Yes, basically we talked about putting pressure on the wound. In an event like this, when you fill the void, you're now putting pressure directly on the artery itself. There's a lot of muscle and tissue here when, if I go back one, sorry. If you notice, depending on how bad the wound is, we're applying pressure. We're putting pressure here. There still may be a huge gap allowing blood flow to go through. But by by filling the void here, you're now putting pressure even closer to the actual bleeding of the wound. Make sense? Everybody here has gotten bumped their shin or bumped their head and gotten a bruise, right? And you see it swell up a little bit. That's a lot of room. That's basically bleeding, internal bleeding. In your arm, think about for you to get a bruise on your upper arm. That's a lot of tissue for the blood to fill into. So think about it if in an extreme case, that's why you need to fill the void. Like we said before, apply pressure after packing. And worst case scenario, if that does not stop the bleeding, you're going to apply a tourniquet. There are a lot of different tourniquets out there. The two most popular are the CAT tourniquet, which is what generally is used in this area in civilians. I'm going to hand them out for you guys to look at. Tourniquets do not cost that much if you look on eBay. They're pretty simplistic to use.
Why don't you see these in CVS?
Actually, I have seen them in CVS. Yes, not all CVSs carry them. It depends on the areas that you're in. But I've also seen them in hardware stores. I'm starting to see them more there. I know some people who've taken these classes end up buying the particular one that you have with you right now, and literally keep it in their briefcase or their backpack or their purse, just in the event it's ever needed. There's another one out there that it has metal on it. Most people go with the plastic one because if you go and travel a lot through like TSA and stuff like that, it won't set off any of the detectors.
Is this unique or good in any particular way?
The reason I like the CAT tourniquet, one, it's plastic, it's lightweight. Tony, can I borrow you real quick? Thank you.
What is this?
That is called a windlass, and I'm going to explain everything. I apologize, our chief was going to be here. He got called away on other business. Hence the reason I'm doing this solo. The way you apply a tourniquet is if Tony's bleeding, let's say he cut himself right up here. The tourniquet can be applied two different ways. The CAT version of the tourniquet is usually pre-looped like you guys have it. You're gonna open it up, apply it as high and as tight as possible.
So above the wound, you're saying?
Yes, above the wound. Do you want to do as high as tight?
Is in the hand, would you
Still as high as tight as possible.
Oh, wow.
Yes. You're going to take the one end. If this gets too tight, let me know. And you're going to do it as tight as humanly possible.
Okay.
Okay.
Am I turning purple?
The little stick up here is called the windlass, and this is what makes the tourniquet actually tight. What you're going to do is start twisting it. Okay. And you twist it. You good? Until you can't twist it anymore, and then you're going to put it into the latch there. Make sense? Okay. Here comes the fun part. Pick a partner. We're going to apply this to each other. We're not going to tie this too tight, but I want you to understand if you had to apply it to her or you had to apply it to him. Make sense? Yep. Just remember, if you were doing this in real life, I would do it much higher. Okay, much higher. And
I got it, I saw it.
yeah. Okay. And then switch.
Like this?
Yeah. You want it a little higher?
A little higher, even, huh?
As high as tight as you can make it.
High and tight.
There you
Where
go.
can we purchase these?
You can see
CVS?
some CVS's, Amazon or whatever online retailer you use.
Okay.
Uh-huh. And then what you're going to do is twist this.
What's this?
Mhm.
Okay. That's interesting.
Oh.
And you can see how it gets tight.
Oh, yeah. It's not too tight, but you can feel it. Yes, yeah.
And then you clip it to this here.
Yeah, blood being saved. Oh, yeah. Save a life. Save a life. Thank you. So is this to be used in what may feel extreme blood loss, or if somebody cut their finger with a knife?
Extreme blood loss. If you see somebody where you cannot stop their bleeding, this is an extreme blood loss situation.
So
It-
like, in the case of my husband having a deep cut on his thumb,
You-
not necessarily.
The first thing you did was wrap it, so you applied pressure,
Yeah.
and did that stop the bleeding? It may.
But we got in the car to go to the ER immediately.
Was he bleeding so profusely it bled immediately through the stuff? Did you apply more pressure?
I think we just kept wrapping it.
Okay.
Yeah.
In extreme situations, you apply pressure, it bleeds through a little bit, you apply a little bit more pressure, the bleeding slowed down. If I applied pressure, put gauze or whatever over it and wrapped it and immediately became soaked, and then put another one and immediately became soaked, then I might think about doing that. It depends on the volume.
And if you don't have one of these in a situation, like, can you use something that approximates it?
Yes. So, in extreme cases, if you have, what you really want to try to use is like a belt or something wide. I know there are books out there and educations and stuff like that that tell you to apply the tourniquet with like rope. Rope may actually do more damage than not. So you want something wide so it pushes pressure on the artery.
Like what,
Correct.
like a long sock or something?
Socks may be very stretchy. It may eventually be used, but you're going to have to do a lot of twisting to get that extra strength out. That's why they suggest about. The other thing that you want to do, may I borrow you for 1 second, sir? Here, let's turn this way. In the event I decide to make my what I call a home tourniquet or a MacGyverized one, and this is a wide, something wide like a leather belt or just something like that. Just hold that for 1 second. What you're going to do is when you wrap the arm, you're going to take a pen or
Oh.
make a windlass out of the stick
Wow.
or something else.
Cool.
Do that.
Oh, and then you can twist it?
Yes.
Yeah. Very good.
The big thing is when you apply the windlass, you want to make sure it's wide. If you do rope, it may actually cut more into the person's skin. And the other important thing is after you apply the tourniquet, if you guys noticed, there's a little flap that goes over where you lock it in place. You want to mark the time.
What do you mean, mark the time?
Mark the time you applied the tourniquet.
Oh, yeah.
Not, you don't mean physically marking, you mean just pay attention to the time.
You want to literally, if you have a pen, write the time on the tourniquet.
Why?
The reason is because it used to be the reason years ago it was talked, oh, don't use tourniquets, people are going to lose their limbs if it's on for a certain amount of time. They've had tourniquets applied to soldiers in combat for over 24 hours, and these surgeons were still able to save the limb. And they just need to know how long that arm has been in a tourniquet for. Make sense? So, and in the event that you're doing one of a homemade brand of that type of tourniquet with a belt or whatever, and you don't have a place to mark it on the tourniquet, you can literally write it on their forehead. Yeah. Make sense?
Yep.
And in the event you do apply a tourniquet and somebody comes up or the EMS comes up, you're like, I applied the tourniquet, I did the direct pressure, it just bled through, I couldn't stop the bleeding, it squirted, I applied the tourniquet, this was the time. That's really important information for us to know. Questions regarding the tourniquets? Okay. I mentioned before, if you've ever heard, oh, if you apply the tourniquet, they're automatically going to lose the limb. That really depends on the type of damage and everything else. I've had this tourniquet on, and if you've noticed, my hand is now blue. Okay. I've had the tourniquet on since pretty much when we've started. I can take this off and it'll be fine. I'm starting to get little pins and needles, and that's okay. I don't suggest this for everyday use. I just do it as an instructing purposes. But the other thing is, the way I know the tourniquet's not working is feel for my pulse. If you put your hands right here. You're not supposed to. That's how I know if I applied a tourniquet.
It's proper if you.
Yes. Okay. When you check for a pulse, always do it with your fingers. Your pulse has your own thumb.
Oh.
Yeah. There you go. So what we're going to do now, eventually, what we're going to do now is, since I have two mannequins up here, we're going to go up, apply pressure, try to fill the void, and then if that doesn't work, we're going to try to apply a tourniquet. Make sense? Yes. If you don't want to do that, that's fine. Okay. Landscapers, non-gas powered lawnmower just exploded, and he's got a big cut on his leg, and he's bleeding. He's asking for help. You know the scene is safe because there's no gas or anything.
Okay.
You've called 911, and he's bleeding profusely. What do you do?
First apply pressure.
Go ahead.
Okay.
Harder. There you go. Apply pressure.
Really?
Yes.
That hard?
Yes.
Okay.
It's bleeding through. It's bleeding through.
More.
Okay. Still bleeding through. So what are you going to try to do?
Tourniquet. So
Before
do I let
tourniquet?
this up?
Let's try to fill the void first.
Oh, okay.
All right.
So I'm gonna just take this and,
Don't put your fingers in the wound. Just over the top and push it in. There you go.
okay.
Yeah. Wait, what you want to do is sit there.
So I take everything off to do that.
If Yes, if you apply pressure and it like just soaks right through,
Yeah.
you put more and it still does it.
Just keep doing this.
Yep, there you go, that's perfect.
And then,
Now, what I want you to do is
yeah,
keep filling that void.
okay.
Tell me when it's full.
This is a lot.
Yes. Remember, your muscles, your tissue inside are all like sponges.
Okay.
If you think like, oh, okay, that's a solid arm or whatever, if somebody's bleeding and you want to push and you're trying to fill that void, you have a lot of, picture all soaked sponges, you're now pushing down to create that pressure.
Now I'm pretty full.
There, you're pretty full, and then you're going to hold this over.
Yep. And then am I going to put this on too?
Yep. And just hold it. And if it's still bleeding through, or let's say in a situation, if you came over and it's just squirting,
Yeah.
are you going to do that or go straight to the tourniquet?
I would, oh,
It's okay.
I think I would probably go straight to the tourniquet.
If it's squirting out and you just see,
Yeah.
wow, there's like three 2-liter bottles of soda, I'm going to go straight to the tourniquet.
Okay.
Make sense?
Yeah.
But if it's something like, okay, it's just pouring out
Yeah.
versus squirting, but if it's squirting, I'm going to go. So you stop that bleeding, but his other leg's now bleeding and it's just squirting, squirting, squirting.
All right.
Sorry.
So let's assume this is the top of the leg.
Yep.
Uh-huh. Make that as tight as I can.
Keep going. Now, one of the things when I became an instructor that I was taught was when the person stops complaining of their injury and starts complaining of the
Tight.
tourniquet,
Yeah.
it's probably tight enough.
Okay.
This will hurt them. This should hurt them more than the actual wound itself.
Wow.
Yes.
Okay.
But them yelling, them screaming, them complaining, guess what that means? They're alive. They're
Right.
yeah.
They haven't passed out.
They haven't passed out. They haven't lost consciousness. Those are all good signs.
Okay.
Make sense?
Yeah.
Okay. And then you just remember to mark the time.
Oh, right.
Okay, who wants to be next? We're going to start on this one.
Okay.
You were walking down Valley Road and somebody fell through a plate glass window and they're just squirting out blood.
Okay.
So you got a tourniquet right there,
Oh, squirting out, right.
yeah, squirting out.
And just,
One more time. It's going to be tough. There you go. Write the time and then cover and perfect. Okay. Okay.
can I try it just,
Yeah, absolutely. Yes.
Pack it after the
You fill the.
just want to experience
Yeah,
it?
if you want to, yes, but if the bleeding stops, just apply pressure and then wrap the wound tightly with a pressure bandage.
I see. Do simulate a
Mm-hmm.
cavity. Thank you.
You're very welcome.
Okay. I get it.
Okay. Here's a question for you. We've applied a tourniquet, but it's still squirting. Do we take off the tourniquet?
No.
Good answers. What do we do? Okay. we apply a second tourniquet. If you look over here, that's a picture where you apply a second one and put it on a second time. There are times that you apply a tourniquet, it may stop bleeding, and then for whatever reason the person moves around, the tourniquet got loose for whatever reason, and then it starts bleeding again, and that's when you're going to apply a second tourniquet.
One question, sorry. If you're by yourself, are you already going to talk about this?
Did you read ahead?
I'll shut up. Okay.
If you're by yourself, yes, you can apply a tourniquet to yourself. As EMS workers, with the dangerous situations that we could hypothetically be in, even though we try to avoid it as best as possible, we do actually train to self-apply these in the event that we're hurt in a situation. So if I'm by myself,
Yeah.
and hypothetically I get cut in the arm from something, there are some of our employees that actually carry these on themselves. They're called IFACs, which has 2 tourniquets, the packing material, as well as a few other things to treat themselves. And in the event of that, without using this arm,
Yeah.
I apply the tourniquet. As best as I can. And when we go through this class as emergency responders,
Yeah.
we'll be in the middle of this 3 or 4 hour class, and all of a sudden the instructor will walk up and say, everybody's left arm. So the tourniquets that are next to you, you have to apply to yourself.
Okay.
Yes. And you can do the same thing with this and the leg.
Okay.
Make sense?
Yep.
And I've seen, unfortunately, police officers in violent situations self-apply this because there was nobody else close by them, and it saved their lives. Frequently asked questions. Do you ever apply a tourniquet to the neck? No, absolutely not. No, you do not apply a tourniquet to the neck. Anytime somebody is bleeding profusely through the neck, you're going to apply pressure. But when you apply pressure, make sure you're not blocking off their airway. It's one of the few places that when you apply it, you want to just make sure that they're still breathing and keep the airway opened. Head wounds. Head wounds bleed a lot. A lot of people, especially for children, like we get there and there's a lot of blood. Again, you're going to apply pressure. There's no tourniquet to the head. Just apply pressure. You're not going to have to fill the void because there's no major muscle groups up here. Head wounds tend to bleed a lot. If you apply pressure and it's around the skull and it goes in a little bit where it shouldn't, you're just going to apply pressure there and wait for EMS.
And is it better to have someone sitting rather than lying down if they have a head?
And you always want them to be laying down. If they're in a car accident or a fall, you want to keep them in the position that you find. That way we can evaluate for cervical spine injury. For anything related to the chest, if it's an impalement of an object, you do not pull the object out. Okay? I know, forget what you've seen on TV. You do not go, ooh, thump. that's bad. If there's an object physically in the person's chest, you leave it where it is. As EMTs, we don't pull objects out of the chest. We literally have to stabilize it in place. If it's a penetrating wound where there's no object, what you want to do, anything to do with the chest, is put a piece of plastic. Something that is an air barrier is the best way I can explain it. If they do get a penetrating wound to the chest, there is a chance they may have what they call a collapsed lung or a pneumothorax. And the way we can try to assist with that is by covering the hole with a piece of plastic. Make sense? Depending on the first aid kit you get, they have what they call chest seals, which is basically a clear piece of plastic with sticky stuff on it. And you put it over it, and that's all it is. Most chest wounds do not bleed that much. You may get a little ooze of blood, but you will not see anything you should never see anything squirting. Any penetrating wound that you have on the chest, you always want to check the back to see if it went through, especially if it's a firearm related injury. Anything to the abdomen, you're going to apply pressure. If you see a piece of an organ hanging out, do not try to put it back in. You're going to put a wet, moist cloth over it and just apply gentle pressure to it. Make sense? If it's a junctional, shoulder or where the leg meets the groin, you're going to apply a lot of pressure. In the event that, let's say somebody got a bad cut there, and you know it's too high enough to apply a tourniquet, you're going to do your best and apply pressure as much as you can. If it's in the groin area, you can even kneel on right here to apply that pressure if it's not enough. Make sense? Okay. That's only for the groin area. I would not do it for the shoulder area. Same thing with the shoulder area. Pediatrics, again, you're going to apply a lot of pressure. Tourniquets are not meant for, the tourniquets that I showed you are not meant for pediatrics. They're mainly meant for adults.
So even if a child is bleeding,
You're not going to use the commercial available tourniquets because these are made for adults.
why not? What's the difference between a child and adult?
It's the design of the tourniquet is made for a certain diameter where a child or infant's leg is not going to be able to apply that much pressure. I'm not saying not to use a tourniquet, just not the commercially available. Don't use this one or the other commercially available ones. What's the first and most important thing that you guys need to do in case of an emergency? What's the second most important thing? Make sure you're safe. I cannot express that enough. I have been, throughout my career, I became an EMT in 1994. I have gone to call accidents, not only in Montclair, but other areas I've worked, for a pedestrian struck. And by the time we're a block away after being dispatched, be advised we have a second pedestrian struck at the same location. Because somebody was like, I just took this class. I learned all this great stuff. I saw somebody get injured. I ran out. I didn't look both ways before crossing the street. And then we get there and we have one critical patient. Now we're treating the other person, and now we have to wait for a second ambulance before we can transport the first person. Make sure the scene is safe. If you do apply help, aid, make sure somebody has called 911. Don't say in a crowd, hey, call 911, because you know what everyone's going to do? Oh yeah, somebody should do that. I'm sure they are. Oh look, they're on their phone, and so are they. Everybody's called 911. There was a great story where a person collapsed out of a mall somewhere in central United States, and somebody collapsed, ran up. They people said, call 911, say, call 911. He looked up and he saw like 6 people on their phones. Took another about 8 minutes before somebody actually called 911 because everyone assumes somebody else did it. So if in the event you're in a bad crowd of people, like, you call 911, make sure you point to that person, confirm that 911 was actually called. Okay. Remember, you're going to apply direct pressure. If you need to, fill the void. And then the worst case scenario is you're going to apply a tourniquet. But if you walk in and you see blood immediately squirting, what are you going to do? Tourniquet. What's the most important thing to do in an emergency is to, after call 911, make sure you're safe. These are 2 QR codes that we'll make available. Each one of you will receive a certificate from the American College of Surgeons and the Stop the Bleed program. Probably give me a week or so. And I will email those to you, and you'll be registered and everything else. The American College of Surgeons Stop the Bleed equipment, or you can go online and look up your for yourself for whatever type of other tourniquets. The other tourniquet I mentioned is a little bit different. That's pretty popular. But as you can see, it's made out of metal.
More effective than the other?
They're pretty much the same. It all depends on the person using it and how comfortable they are. You guys see that one. The big difference with this one is that one, you have to unravel the whole thing to open it up.
Whereas that one doesn't.
This one,
This doesn't have Velcro. Yeah, I see. I like that actually.
this actually has a metal clasp.
Oh.
And the locking part to make sure it stays in place is another triangle piece here.
What do you like better between the 2?
I use the plastic one the most because if I do travel, I can keep it in my bag and I don't have to worry about this not sending off a metal detector. That's my personal preference. I do not endorse any one or any specific brand of tourniquet. Neither does the American College of Surgeons. But you'll see a lot of different ones out there. If you do get a tourniquet, I suggest doing 2 things. One, buy 2. One that you can open up and play with and get familiar. That way, you're not in the middle of an incident like, all right, how do I use this? Where are the instructions? You don't want to do that. Take one out, open it, play with it. And the second part is if you do get it, they're usually shrink wrapped in plastic. If you're like, okay, this is the one I'm going to use for an actual emergency, take the shrink wrap off and leave it wherever you decide, in your glove compartment, in your backpack, in your purse, in the new fanny packs that everybody's wearing, whatever you want to do. Just make sure the plastic's off. That way, in the event something does happen, you can take it off and you can immediately apply it. The individual first aid kits that we have are IFAC kits. You may see EMTs walking around with a pouch on their side. That's what's in those. And the first thing we tell everybody that has one is open it up and then take all the plastic wrap and everything else off, because if you're going to use it in a time-sensitive manner, you need to pull it out and just use it right then and there. Make sense? And the individual first aid kits, that are sold sometimes do come with those what they call chest seals as well as the packing material. You may hear something called hemostatic gauze, which is special gauze that you fill the void with, and it's got crystals on it that will help stop the bleeding, basically. It encourages the clotting factor for it. Make sense? Does anybody have any questions on anything we've gone over? Go ahead. Oh, go ahead.
So, one is, my mom, who is right behind me, um, once had a fall where she had severe internal bleeding. And I'm
But I
wondering,
didn't know that.
that's the question. Is there any way to know and to do anything?
If you have somebody who suffers a severe fall and you suspect any type or even possibly of internal bleeding,
Yeah.
like a fall down the stairs,
Yeah.
and the EMT suggests we're going to go to a trauma center,
Yeah.
just agree with them.
Okay.
Because the trauma center, the reason an EMT said, hypothetically, if you say, I want to go to hospital A,
Yeah.
and you're like, no, you really need to go to a trauma center, we're going to do everything in our power to convince you to do that, is because for whatever reason, during our assessment or possibly due to your assessment and mechanism of injury, we realized that you need to be evaluated by a surgeon. And a trauma center physically has a surgeon in that room 24 hours a day, 7 days a week. Like, we go in there, and if we said, all right, we're going to send in a trauma alert, we'll call ahead, and then you get met by a nurse and an entire team of doctors, and they're going to evaluate you within minutes, depending on their first evaluation. Internal injuries, there's not much you can do other than surgery. Make sense?
Yeah.
What's your second question?
Okay, my second question, I was once in New York City and witnessed a terrible fall where someone bleeding severely from their forehead, and it took such a long time for emergency services to come, like over 20 minutes. And I'm just, we stayed with the person, but I'm just wondering, when you're in a situation where you're having to wait, besides these things, what should you do?
The biggest thing, other than preventing, like, stop the bleeding, I'm going to put pressure on this thing, and it happens to us, is the biggest 90% of the job that we do is talk to people.
Right.
Whether they're on the brink of a cardiac emergency or trauma or whatever, we sit there and we talk to them. We calm them down. We let them know what we're doing, and we do the best that we can reassuring them. Holding of the hand of somebody who is scared really, really makes a difference. One of the unique things is anytime I treat a patient, hi ma'am, I'm Mike from the Montclair Ambulance Unit. Majority of the EMTs at Montclair Ambulance Unit are taught that we're taught, hi, my name is Mike. It's an introduction. It makes the person a little more comfortable. Holding their hand, talking to them. There could be a lot of things going on all at the same time, but just by doing that, does a number of things. It brings their heart rate down. It brings their respiratory rate down. If the heart rate goes down, what are they doing less of? Bleeding. Reassure them. It may or may not slow down the bleeding, but it's a good start. If I have pressure on the wound and I start to calm the person down, I said, listen, I know it hurts. Sometimes I'm going to have to move a patient, and due to their circumstances, it may hurt them. And I'm like, ma'am, I'm going to move you. It's going to hurt. I apologize for that. We're going to count on 3, and we're going to do it, and we're going to do it together. It reassures them. Make them a part of the healing process. In the event somebody has a bad wound here, it's like, sir, listen, I know you're panicking right now. I need you to do me a favor. Grab somebody else. I need you to tell me your full name. Where do you live? Give them something to do to take their mind off of it, but at the same time being productive. Make sense?
Okay, sorry, third question.
It's okay.
It has to do with bleeding. My husband went into anaphylactic shock while I was with him.
Mm-hmm.
And I'm just curious if you could just give very briefly what you do if you don't have an EpiPen and that happens.
In the event you don't have an EpiPen, make sure 911 is immediately called. The Montclair Ambulance Unit does carry EpiPens with us. And the majority of EMS services do. Some may or may not. I don't know. I can't speak for other services. Immediately try, one, if you know the allergen, make sure we know what the allergen is so they can follow it up at the hospital. Call 911 immediately and keep them as calm as possible. That's the best thing you can do, because without that EpiPen, there's not much other immediate medical treatment that they need. If their neck is swelling, their throat is swelling, they need that epinephrine as soon as humanly possible. You're very welcome. What other questions can I answer for you guys? I know we went over a lot of information. This is going to be on Montclair Television, thanks to the Township Council. So you can go back and refer it. There's also the stop. If you go onto any internet browser and look for Stop the Bleed, they have a lot of information there. They have a lot of posters and things of that nature. If I know the Montclair Ambulance Unit are in the process of possibly looking into selling first aid kits. When that comes out, look on our social media. We'll let you know, along with a very basic version of a first aid kit. So we will let you know that via social media as well. In a couple years, think about taking this class again, because there's always updates. One of the biggest things that we try to teach our people is the most dangerous words is, this is the way we've always done it. Things constantly change. We have to constantly keep on learning. So that's why we keep on taking this continuing education. And the Stop the Bleed program, maybe in 2 years something else has changed that you can come out here and do it. Any other questions, comments, concerns? Thank you guys very much.
Thank you, that was so
You're very welcome. And give a week to 2 weeks before you guys get emailed your certificates. And make sure you've signed in, and please print neatly so I don't mess up your names. Thank you.